A very good evening, everyone. Welcome to our Sincere Healthcare Group Facebook Live. And today we have our Dr. Ho Siew Hong and a urologist with us to share with you on the topic infertility on male factor. So, welcome, welcome, Dr. Ho. And do you mind to introduce yourself to our audience?
Thank you so much for having me. My name is Dr. Ho Siew Hong, and I'm a practicing urologist. A urologist is a surgeon that deals with problems of the kidney, urine tube, bladder, prostate, and the male genitalia. We cover these problems in both the male population as well as in the female population, including the children population.
So, what is the urology problem?
Urology covers the organs of the kidney, bladder, and the prostate. So we deal with common problems in these areas, such as kidney stones, cancers related to these areas, such as kidney cancer and prostate cancer, and also the male problems, such as male fertility. Now, for kidney stone, it is a very common condition in Singapore, mainly due to our hot and humid weather, and many of our people undergo dehydration without even realizing. Kidney stones can present with pain at the back, blood in the urine, or discomfort when the person passes urine. And this will then lead a person to see the family doctor or a urologist like myself, and we'll do some scans and tests to confirm the presence of the stone. As for prostate problem, it's a very common problem for men above the age of 50 years old, where men begin to experience more and more difficulty in passing urine, more frequency in passing urine in the day as well as in the night. And prostate problem can be diagnosed through simple blood and urine tests. As for fertility, that is my special area of interest, where I handle a lot of males having difficulty in having children.
And what are the symptoms of male infertility?
Now, male infertility actually does not really present with a symptom. They usually present as a healthy young couple that have been married for more than 6 months to 12 months, have been actively trying to have a child, and yet they cannot conceive. And quite often, the lady will be directed to see her gynecologist first for further evaluation. But we all know now that about 1/3 of infertile couples are actually related to the male factor. And in Singapore, up to 10% of married couples may be subfertile. Now, this man is a healthy young man who has no real complaint in terms of his urination, in terms of his abdomen, in terms of his genital organ. He will only know that he has fertility problem when we conduct a sperm test or a sperm analysis.
And why would we need to see a urologist?
Well, a urologist handles the entire male genital area. So, if there is a problem with sperm production, such as reduced sperm production or decreased sperm production, then we will be able to evaluate the factory of the sperm, which are the testicles. The urologist can examine the testicle to determine the size of the testicle, determine whether there are any lumps or growth in the testicle, and determine whether there are any associated abnormal structures next to the testicle, such as abnormally large vein called varicocele, that can affect the function and the production of sperm. In addition, the urologist can also evaluate the hormonal status of a man. The male hormone for a man is called testosterone, and testosterone makes a man a man. It makes us active, gives us our muscle and our bone structure, but it also helps us in terms of good quality sperm production. We detect testosterone level from a testosterone blood test.
So what can be done for male infertility?
There are actually many things that we can do for a man, which many of our patients do not realize. They have only heard about intervention for their wives or for the ladies. But actually, because 1/3 of men actually contribute to the fertility problem, there are lots of things that we can do. Upon detection of an abnormal sperm test, an abnormal sperm test can mean reduced sperm count or decreased quality of sperm count, which means they have enough sperm, but the sperms are not swimming in the right manner, not active, or a lot of abnormally shaped sperm. We will then look at the sperm analysis and determine whether these problems are mild problem, moderate problem, or severe problems. In cases of mild problem, we can often rectify them by simple change in lifestyle, such as a bit more rest, less stressful life or career, reduction in alcohol consumption, and also reduction in tobacco consumption. We can also encourage them to have a better diet, weight reduction, and exercise. So these little lifestyle changes can improve a mildly abnormal lifestyle. In addition, we can give them oral supplementation. These are simple pills that are targeted at improving sperm formation that we can supply to our patients to be consumed over a couple of weeks or over a couple of months, so that the new sperm that is formed will have better quality. As for the more serious case, then they will require further evaluation by the urologist, usually in terms of blood tests, more detailed sperm analysis, or further ultrasound examination of the testicle.
What are the chances of getting treatment?
The chances of improvement is actually quite promising for a man. For mild cases, like what I mentioned, simple lifestyle changes, supplementation may actually push the sperm count back to normal levels, where the couple then can go on to try to conceive naturally. In the case of moderate abnormality in the sperm count, which means it is a little bit more serious, and we determine that there is an obvious reason. For example, the presence of an abnormal blood vessel called a varicocele. We can then proceed to confirm the diagnosis by doing an ultrasound of the testicle, and then proceed on to do a simple day surgery to tie off these abnormal blood vessels. By tying off these abnormal blood vessels, we actually decrease blood flow in these abnormal blood vessels, decrease the pressure and temperature to the testicle, allowing the testicle a better environment to produce better quality sperm. This intervention can also lead to a significant improvement in the quality of the sperm count. In more serious cases, where sperm count is extremely low, or the quality of sperm is so poor that the sperm hardly move, then we can assist our gynecology colleagues in the IVF process, where we contribute in harvesting sperm directly from the testicle. We can do a minor day surgery procedure where we enter into the testicle, harvest, but first of all, look under a microscope for the better quality sperm and harvest this sperm so that we can then give it to our gynecology colleagues, and they then in the laboratory can unite this sperm with the eggs that they have harvested through the IVF process. So we act as a supporting role for the IVF process.
And if let's say we have a patient asking that why is my sexual drive is actually lower than normal?
Yes. Now, sexual drive is quite often related to the male hormone level, the testosterone level. Alright. But sexual drive can also be low due to other psychological factors such as stress, inadequate rest, sometimes even performance anxiety, where this couple has gone into what we call timed or planned intercourse, where they know that tonight may be the night that they are fertile, and he is then obliged to perform his duty, and he has performance anxiety and he cannot perform. So that can also cause a reduction in his desire. Now, in most cases, it is attributed to low male hormones, and that we can easily diagnose with a simple blood test for testosterone level. And if we find that the testosterone level is below normal, we can supplement the testosterone level by prescribing a pill, a gel, or even an injection.
And what is the ideal condition for sperm?
The ideal condition for sperm production is that the temperature of the environment should be slightly lower. That is why, for a man, the testicles are located outside our body, because the testicles function best at a temperature of 1 degree lower than our core temperature. The testicle also functions better if there is no surrounding pressure from abnormal blood vessels. So, in general, we will advise our couples who are trying to conceive for men to not wear too tight clothing, where the testicles then become compressed against our body for prolonged period of time. We are not saying that they should not wear pants or should not wear underpants, alright? Yeah. But they should not be wearing very, very tight clothing for a prolonged period of time.
And what are the treatments done for a male patient with a low sperm count?
Well, the mild ones can be easily treated with lifestyle and supplementation. So we go on to the moderate and the more serious ones, which I very briefly explained earlier on, that we can correct what we feel are abnormal factors, such as abnormal blood vessels called varicocele, and these are corrected surgically. And in the extreme case where sperm count is extremely low, or sperm motility or ability to swim and move is extremely low, we can bypass that by going directly into the testicle with a minor surgery. We harvest the sperm directly, and in the laboratory, we literally take over the function of the sperm. We take the sperm and inject it directly into an egg in a process called IVF ICSI to help them form an embryo. And once the embryo is formed, the embryo can then be transferred back to a lady, and she will then receive the embryo, and if the womb accepts the embryo, she will then go on to a normal pregnancy and delivery.
How does IVF and IUI help to overcome male factor infertility?
IUI is in utero insemination. It is almost like doing intercourse, except that in a very controlled manner. In IUI, a sperm sample is collected from a man through masturbation, and then the lab processes it on the same day, activates the sperm, and then the gynecologist will squirt the sperm into a lady's vagina. But the sperm will still have to then swim up the cervix, the womb, and penetrate the egg in order to fertilize the egg. So the sperm still has to do quite a lot. So if a man has poor or low number of sperm count, we can do processes that we mentioned earlier, such as lifestyle modification, supplementation, or even varicocele surgery to improve slightly the quality of sperm and numbers, so that they will then have a better chance with IUI or in utero insemination. In IVF, the same happens, because in normal IVF, once the egg is harvested, a sample of sperm that is collected through masturbation is mixed with the eggs, and the sperm will then do a natural selection and penetration into the egg. So if we can improve the quality and the quantity of sperm, then the chances of this sperm uniting with the egg and eventually forming an embryo will be much better. Lastly, like what we mentioned, if we use the technique of IUI ICSI or IUI ICSI, which is a more advanced method, we can then harvest sperm from men who have extremely low sperm count, extremely low quality sperm. We can still harvest this sperm, use the DNA material from the sperm to unite them in the laboratory with an egg, and eventually form an embryo and leading to a pregnancy.
And okay, thank you, Dr. Ho. And finally, we are coming to the end of our Facebook Live. And we really appreciate Dr. Ho for coming on the show, sharing with our audience. And we will see you next time. And so to follow us on our Facebook page at Sincere Healthcare Group. We see you next time.